I'm Rachel North, an optometrist from Cardiff University. It's good to have the opportunity to present our study investigating the impact of COVID-19 upon primary eye care services provided by optometrists in Wales. Just a little bit about the background. During this pandemic period, Welsh Government and health boards decided to streamline optometric services in Wales. All routine appointments ceased after March the 17th. Then, following discussions between Welsh Government, Health Board and Optometry Wales, it was agreed that patients with emergency conditions, such as reduced vision, or those requiring essential care, were to be seen in a reduced number of primary eye care optometric practices. 25% of practices provided the service, covering every cluster. And all optometrists were Eye Health Examination Wales or EHEW accredited, and also some were independent prescribers. The aim of our study was to compare the acute eye care services provided by optometrists before COVID-19 and during COVID-19 lockdown. Each optometric practice recorded non-patient identifier data in an online form. We reviewed these forms to determine the volume of patients, demographic presentation, presenting symptoms and eye conditions, referral pattern among different professionals, types of medication perhaps prescribed, and variation in management options. Data collected from the 14th of April to the 31st of May 2020, the COVID-19 lockdown period, were compared with that for a similar period in 2019 for 6 health boards. The results that I'm presenting are from the 6 health boards combined. This slide shows the number of patient consultations for acute eye care from the 14th of April to the 31st of May in 2019 and 2020. The blue bar represents the number of patients between April and May in 2019. This is the pre-COVID period. The red bar shows the number of patients between April and May in 2020, the COVID lockdown period. It can be seen that there has been a 38% reduction in patient consultations during the COVID lockdown period. This slide shows the age distribution of patients requiring acute eye care. Again, the blue bars show pre-COVID data and the red bars show COVID data. It can be seen that during COVID, there is a reduction in the percentage of patients over 60 years of age compared to pre-COVID, and that there is an increase in the under 60-year-olds. Also during the COVID period, more women than men had consultations. 58% were women. Next, we looked to see who the patients were referred by and the form of consultation during the COVID period. It can be seen from the figure below that of the 7 categories for referral, the vast majority, 74%, were patient presentation, and 16% of the referrals were made by GPs. Regarding the form of consultation, 70% of patients required a visit to the practice for an eye examination, and 26% of consultations were by the telephone with the patient, carer or guardian. We then looked at the symptoms that the patients reported. This figure shows the percentage of symptoms for each of the 10 categories. The 2 leading symptoms reported were eye pain or discomfort and red eye, and both of these decreased during COVID. Symptoms that increased during COVID were diplopia, headaches, which nearly doubled in percentage, chronic and acute vision problems. We then looked at the clinical findings. Of the 6 categories, the commonest was anterior eye problems. and these were reduced during COVID compared to pre-COVID. These conditions were mostly those affecting eyelids and lashes, conjunctiva, cornea or sclera, and dry eye. It can also be seen that all the ocular abnormalities reduced during COVID except for the post-operative complications. We then reviewed the medication or treatment advised. The distribution across the 4 categories is pretty similar for pre-COVID and COVID. Dry eye drops accounted for just over 50%, and chloramphenicol accounted for approximately 25%. Dry eye drops are not only used for patients with dry eye, but for other conditions such as viral or allergic conjunctivitis or post-trauma. Chloramphenicol may be used for patients, for example, with acute bacterial conjunctivitis. We then looked at the actions taken or the management, and the figure clearly shows that the vast majority of patients were managed by optometrists in practice and did not require onward referral. About 65% of the patients had an advice or regular review. Other patients had a follow-up for their acute eye care condition. And other patients may have had foreign bodies, perhaps from cornea or conjunctiva, or eyelashes removed whilst in practice. Only 12% required urgent or emergency referral to the hospital eye service. And the percentage of prescriptions provided by optometrists approximately doubled during COVID. Finally, our conclusions. During the COVID versus pre-COVID period, there was a marked reduction in patients attending for acute eye care. There was a reduction in percentage of patients over 60 years of age requesting a consultation, and an increase in the under 60-year-olds. There was an increase in the percentage of patients presenting with acute and chronic vision problems, diplopia or double vision, and headaches. The most common clinical finding was anterior eye problems, and the main reason for referral to a pharmacy or revised medication was for dry eye drops. Approximately 3/4 of the patients were managed by the optometrists and did not require referral to other health professionals. Only 12% of patients required urgent or emergency referral to the hospital eye service. Optometrists have demonstrated that they can reduce the workload of the hospital eye service by providing these enhanced optometric services in community practices. Thank you for your attention.